Hello, my name is Natalie Thatcher, and I'm going to be presenting on the opioids epidemics. Pain functions as an essential warning mechanism of the nervous system in which sensory signals sends information to the brain, allowing the body to recognize potential threats and initiate a protective responses. The brain interprets these signals and guides behavioral and physiological actions intended to limit harm and maintain safety. Pain is commonly classified by duration as acute or chronic, or by mechanism, including nociceptive pain and neuropathic pain. Pain processing involves transduction, transmission, perception, and modulation within the nervous system. The pain perception plays a significant role in the clinical decision making because an individual experiences pain influences both pharmacological and non-pharmacological treatment approaches. The brain does not interpret pain through a single pathway. Instead, multiple neurologic systems work together to shape how the pain is understood and responded to. The sensory discriminative component helps identify the location and intensity of the pain. The affective motivational system influences emotional and behavioral responses, and the cognitive evaluative system integrates past experiences and thoughts that can modify how pain is perceived. These processes involve higher brain structures such as the somatosensory cortex, limbic system, and cerebral cortex, highlighting the complexity of pain perception. The type of pains are nociceptive pain and neuroceptive pain. The development of nociceptive pain begins with the stimulation of receptors located in the peripheral nervous system, following exposure to a harmful stimuli or tissue damage. Neural impulses travel through ascending pathways to the brain, where they are interpreted and integrated into conscious awareness. These interactions between peripheral signaling and central processing allows the body to regulate pain responses and initiate protective mechanisms. Neuropathic pain develops when dysfunction occurs within either the peripheral or the central nervous system, leading to altered transmission or interpretation of pain signals. In peripheral neuropathic pain, repeated exposure to harmful stimuli can increase the excitability of the sensory neurons, particularly within the structures such as the dorsal root ganglion. In contrast, central neuropathic pain is associated with neuroplastic changes within the brain and spinal cord that amplify the nociceptive signaling. These alterations in neural processing can result in the heightened sensitivity or disproportionate pain responses, emphasizing the complex role of the nervous system adaptation in chronic pain conditions. Opioids pharmacodynamics. Opioids are a class of pharmacologic analgesics agents that produce a pain relief by binding to the opioid receptors within the central and the peripheral nervous system, particularly the mu opioid receptor subtype. Opioids provide analgesia by activating these receptors throughout the central nervous system, which decreases neural excitability and reduces neurotransmitter release along the ascending pain pathways. As a result, the brain perception of the pain stimuli is modified, leading to effective pain control. However, the same mechanisms can also contribute to tolerance, dependence, and other adverse physiologic effects when opioids are used long term. The pharmacokinetics play an important role in both therapeutic effectiveness and risk for misuse. Difference in absorption, metabolism, and elimination influence how rapidly opioids reach the central nervous system and how long they remain active. Hepatic metabolism through the cytochrome P450 enzymes and individual genetic variability can alter the drug response. which may contribute to the unintended adverse effect or increase abuse liability. Understanding these pharmacokinetic factors helps clinicians make safer prescribing decisions in the context of opioid epidemic. Common opioid medications vary based on their origin and pharmacological properties, including natural, semisynthetic, and synthetic compounds. While all opioids act on a similar receptor systems, difference in potency, lipophilicity, and metabolism influence their clinical use and risk profile. Medications such as morphine and oxycodone are commonly prescribed for severe pain, whereas agents like fentanyl are significantly more potent and require careful monitoring due to their rapid central nervous system effects. Some examples of natural opioids are morphine and codeine, semisynthetic opioids, oxycodone, hydrocodone, and hydromorphine, synthetic opioids, fentanyl, methadone, and tramadol, and the clinical use can change from moderate to severe acute pain, chronic pain management, or palliative and postoperative care. Risk and adverse effects of opioid therapy. Although opioids provide effective analgesia, their pharmacological effects on the central nervous system also increase the risk for adverse outcomes. Tolerance and physical dependence may develop with repeated exposure. While pharmacokinetic variability can lead to unpredictable drug level, in some cases, prolonged opioid use may even increase sensitivity to pain, a phenomenon known as opioid-induced hyperalgesia. These risks contribute significantly to the challenges associated with opioid prescribing and the broader opioid epidemic. Opioid use and abuse. Although opioids remain an important option for managing moderate to severe pain, multiple factors contribute to their misuse and abuse. High prescribing rates and long-term opioid therapy increase patient exposure and the risk for dependence. Neurobiological changes within the brain's reward system reinforce continued opioid use, which may lead to addiction in vulnerable individuals. In addition, social determinants of health, access to care, and inadequate monitoring practices influence misuse patterns. Over time, many individuals who initially receive prescription for opioids transition to illicit substances such as fentanyl, which has significantly contributed to the rising overdose mortality rate in the United States. National, state, and local statistics. At the national level, opioid overdose continues to account for the majority of drug-related death, with synthetic opioids driving recent increase. In Georgia, opioid mortality has risen significantly over the past decade, reflecting on the shift from prescription opioids towards illicit fentanyl. Locally, Fulton County remains heavily impacted with ongoing public health initiatives, focuses on overdose prevention, community education, and expanded access to treatment services. If we look at our chart, it shows how significantly our opioid overdose death has increased over the years. Challenges in adequate pain management and opioid prescription. Healthcare providers face significant challenges when prescribing opioid medications. Clinicians must balance the need to manage pain effectively while minimizing the risk for misuse, dependence, and adverse outcomes. Individual variability in metabolism and responses to opioids further complicates the safe prescribing practices. In addition, stigma and fear of addiction may lead to undertreatment of pain, some population highlighting the importance of evidence-based and monitoring. Resources for opioid use and use disorder and support. Access to evidence-based resources is essential when addressing opioid misuse and supporting recovery. At the national level, the Substance Abuse and Mental Health Services Administration offers a 24-hour confidential helpline that connects individuals and families with treatment programs, counseling services, and recovery support, helping reduce barriers to care and promote early intervention. At the state level, the Georgia Department of Behavioral Health and Developmental Disabilities provides access to medications assisted treatment programs, peer recovery services, and community based support. Locally, Fulton County Behavioral Health Resources offers counseling, harm reduction education, and referral that help bridge the gap between acute care and long term recovery. Understanding this national, state, and local resources strengthens the nurse's role in advocacy, discharge plannings, and continuity of care for patients affected by opioid use and abuse. Case study. It's a female 42-year-old that presents with chronic shoulder and neck pain for over 6 months following an episode of torticollis. Reports sharp pain with movement, stiffness, and burning sensation. She reports her pain score of 5 out of 10, partially relieved with NSAIDs and rest. And her type of pain is a mix of nociceptive and neuropathic pain related to chronic musculoskeletal strain and nerve irritation. Our plan of care and nursing approach for this patient, a multimodal plan of care, was developed to address both nociceptive and neuropathic pain components. Pharmacologic management may include a short-term low-dose opioid trial combined with NSAIDs and muscle relaxant to reduce inflammation and muscle tension. Non-pharmacological interventions such as physical therapy, stretching, and heat therapy support functional recovery and reduce reliance on medication. Patient education is essential to ensure safe opioid use and minimize the risk of misuse. Watson's caring science theory guides this approach by emphasizing empathy, therapeutic communication, and collaboration with the patient to support individualized pain management. Our expected outcomes and evaluations. Pain management outcomes focus not only on lowering pain scores but also on improving function, safety, and quality of life. The goal is to enhance mobility and daily activity tolerance while minimizing opioid exposure and adverse effects. Patient education supports safe medication use and encourages engagement in non-pharmacological strategies such as physical therapy and stretching. Continuous reassessment allows the healthcare team to modify the treatment plan if pain persists, ensuring a patient-centered and evidence-based approach to care. Finally, opioid therapy plays an important role in pain management, but it requires careful clinical judgment to balance analgesia with safety. Understanding the pathophysiology of pain and the pharmacokinetics and pharmacodynamic properties of opioids helps guide responsible prescribing and monitoring. The national, state, and Fulton County statistics demonstrate that opioid misuse continues to be a major public health concern, reinforcing the need for prevention strategies, patient education, and interprofessional collaboration. Through the case study, a multimodal and a patient-centered plan of care was developed using the Watson's caring science theory, emphasizing holistic assessment, shared decision-making, and individualized treatment. Nurses play a critical role in recognizing risk, promoting safe medication use, and advocating evidence-based alternatives to improve patient outcomes. Ultimately, addressing opioid use and abuse requires combining scientific knowledge, ethical practice, and compassion nursing care. Thank you.